Dr. Kourakin, tell us a little bit, kind of make a comparison to us. Tell us in a non-technical, non-clinical way of how your Klencher Crown, which is apparently holding a lifetime, of the tooth, and it's stronger, better, more natural, less invasive. Tell us how you come about to achieve that. How does that work?
Well, Helmut, many years ago, they came out with a veneer, Lumineer specifically, came out with a procedure where you could literally not touch the tooth with a drill. You simply take an impression and you receive a veneer back from the laboratory, you cement it in place, and you've changed the shape of the tooth, and that veneer will hold up 15 years under much different stresses and functions.
And that became very popular. This company who makes the Lumineers, which is just another brand name for a veneer, but somehow they came up with a good way of doing that. That concept really took dentistry by storm, right?
Absolutely. They're extremely popular. Patients ask for them all the time. So we kept that in mind, and not every tooth, especially on the back of the mouth there, is a candidate for a veneer. Most back teeth aren't candidates for the veneer. They're candidates for crown. But, I needed to come up with a procedure that was going to be as minimally invasive as possible, as we did with the veneers, so that we can provide the patient with a service that is going to keep the tooth as vital as possible and give us a structure, a crown that's going to last as long as the tooth is alive in the person's mouth here. And we were able to do that, as I said, by sort of examining the engineering behind the veneers and incorporating it with the construction of our crowns.
Wow. So you basically, took the principle of as you said somewhere, like of engineering and of Mother Nature, and if you fit certain things together, they keep their own equilibrium. They kind of stay balanced or force, and then you don't need so much other force. So basically, that's what you're using to basically you're making a crown, cut it correctly, cut the existing tooth correctly, so that the natural forces help you keeping it in instead of pushing it out.
Absolutely. And once again, the retention form, as I said, it's a minimum preparation, so it's a minimum amount of drilling to the tooth. When the numbness wears off the patients, they'll come back and to receive their crown, they'll say to me, Dr. Kourakin, I didn't feel any pain at all. How did you do that? How did you do a crown where my friends said they had a crown done and they suffered for 1 to 2 weeks? How did you do this? And that's because we were extremely conservative. Just like with the Lumineers prep or veneer prep, you can do that almost painlessly.
Wonderful. So does this type of crown and your work, basically, which what I think it is, demand more money, or is the crown right in the price range of any other crown?
The crown is right in the price range of any other crown. There is a choice of materials that we can use, and the choice of materials will reflect the price of the crown. For instance, the price of gold, for instance, is going through the roof right now, and yeah, that does affect the cost of the structure of the crown.
Sure, but that's with any other crown the same thing. So you have the same choices there. And obviously the look is, again, the same. The lab makes it looking just the way you and the patients kind of decide that it should look like.
Absolutely. Yep.
Beautiful. Thank you very much, Dr. Kourakin.
Thank you.